Our next story has a real bite to it. Over 1,000 people die from snake bites yearly in Papua New Guinea, and this number is in danger of increasing. This is because the snake bite clinic at the Port Moresby General Hospital is facing closure after the announcement that Australian funding would finish at the end of this year. Bradley Gregory was on assignment to meet Papua New Guinea's own snake doctor, Dr. David Williams, who showed us why PNG needs this vital service to continue. Here is Bradley's report, and you will notice that he has a healthy fear for this deadly reptile.
I believe he's the first one for being tonight, so we're
going. It's exciting at the moment. We're actually off to see Dr. David Williams. He's the head of the Australian Venom Research Unit. He's in Papua New Guinea, doing something on snakes, so that should be interesting. Sonia. Because the gate is closed, so we have to go up this way. Dr. David Williams is a snakebite specialist. He has been working in PNG for almost 15 years. His field, venom research and development of medical drugs to assist victims of snake bites. Venom research is important. Samples collected from the snakes in the labs are tested, data is entered into the system, and results are sent overseas to develop right medical drugs to treat venomous snake bites. However, it's at a risk of closure. Lack of adequate support and funding may see the program close down. This means PNG may not have the right snake medicine in future if the program stops.
We basically need around about $500,000 Australian dollars a year to be able to operate and do the things that we do, and we're about $400,000 short. So at the moment we're looking for assistance from anywhere we can get it. We're trying to talk to the Papua New Guinean government for support, but of course they've got their own budgetary problems and budgetary issues. We're talking to private industry, and we're looking for other types of grants, other types of funding that we can apply for.
Dr. David is the only one with extensive knowledge in the field of snake venom in PNG. Part of his job also is training local Papua New Guineans to carry out treatment of snakebite victims. Everywhere in PNG, people die from venomous snake bites. These pictures are from a hospital in Moriguna Station along the Magi Highway, a 5 to 6 hours drive from Port Moresby. While venomous snake bites can kill within 3 to 4 hours, doctors in the area manage the patient while help from Dr. David arrives.
We go as far as Malalaua and as far as Marshall Lagoon. So we go a long way out of town to get patients and bring them back. But we also take phone calls from health centres from right across the whole country asking for advice on how to treat snakebite. It's usually right after you've gone to bed.
Wow.
And this is one of the problems, because people try other avenues to get to hospital first, and it's often after things have deteriorated and become quite serious that they'll call us.
This actually enables them to know which particular snake actually bit them, right?
Not really the snakes, but monitas that affect us. Because when a patient is bitten, the venom goes in and it deeply affects these white colored proteins or white colored chemicals in the blood.
Oh, okay.
And it causes the patient to die.
All right. Specialist knowledge in this field is limited, only to get worse once the clinic closes.
Most of our funding had come in the past from an Australian research grant through the Australian National Health and Medical Research Council, and unfortunately that grant's now finished. And it sort of leaves us in a fairly precarious situation, because we applied this year for continued funding, but it's very competitive and we were unlucky.
Dr. David, in Papua New Guinea, what should a person do when he or she gets bitten by a snake?
Okay, so the very first thing that somebody should do if they get bitten by a snake is move away from the snake. Don't try and catch it and kill it. And then you need to get that person to a health centre as quickly as possible, but not with them walking. You need to make a stretcher and carry them. Don't cut the wound with a razor blade or a piece of glass or anything like that. Don't tie a rope around their leg like a tourniquet. If you're going to do any sort of first aid, you use a bandage, and you bandage the whole limb just like you would if you sprained your ankle, and you splint it as you would for broken bones so that they can't move that leg at all, and then carry them, put them in a PMV, a wheelbarrow, a canoe, whatever you have to do, but get them to hospital, get them to a health centre, ideally within 3 or 4 hours, but as soon as possible.
Dr. David had been beaten before 6 times while doing his job.
Oh, that's a big...
I thought you were over here helping us, Bradley. Come on.
In this feeding room, venom samples are being collected. The Papuan taipan, PNG's #1 killer snake. A bite from this creature can send you 6 feet into the earth if not treated quickly and swiftly.
Just 1 minute.
He's not happy.
After collecting venom samples from the 1.5-meter creature, it was taken back to be put in its home. But the awkward happened. The lights went off.
Oh! What's that?
You guys might want to just head to the door.
We just had to come out now because the power went off and the snake would probably break loose. But just come out.
And if you can help Dr. David Williams and his clinic so that he can continue this amazing research and help save even more lives, then we'd like to hear from you. You can contact us on PNG Tonight on our website, or we'll be pleased to put you in touch with the doctor and his team. Your support is needed. And that's all we have on PNG Tonight. Thanks for your company. We look forward to you joining us tomorrow night, and we'll bring you more of the stories that you want to hear, including the exclusive interview with Cowboys captain Jonathan Thurston. I'm John Higgins. Good night.